Good evening. I hope you had yourself a fantastic week. You're watching your health show, and welcome to the program. I'm Purity Musel. Did you know that smoking harms nearly every organ of your body, causes many diseases, and reduces the health of smokers in general? According to the Center for Disease Control, quitting smoking lowers the risk for smoking-related diseases and can add years to your life. So why is it difficult for you to quit the habit? If you continue smoking, what could be the effects on your health? If you are willing to quit, how can you be helped? Are there any alternative products out there, and how safe are they? Today we talk about smoking and health. Thomas Lindi, coordinator from the Kenya Tobacco Control Alliance, KETCA, is our guest this evening. Our Twitter handle is at KBC Channel 1, at Purity_Musel. The hashtag to use is Your Health KBC. Thank you so much for joining us this evening, and welcome to the show.
Thank you, Purity.
So,
I'm happy to be here.
Yes. When we talk about smoking, maybe we can begin, because we all know what smoking is, but what are some of the harmful effects of smoking?
Okay. Smoking is an addictive habit, and what causes the addiction is the nicotine in the product. Basically, we prefer to refer to them as tobacco products, because some of them are smoked, some of them are ingested, and so on and so forth. So the health effects vary depending on the product. For example, if you are a smoker, you are likely to develop complications in the respiratory system. And those that maybe vape the same way, they can also develop complication in the respiratory system and also in the lungs. But those who use smokeless tobacco products, which are placed maybe under the tongue, for example, lift, and other products, roll your own tobacco, they are likely to develop cancers of the mouth and the gum and the teeth. So all those are the effects that happen, but it's not limited to that. Smoking actually can affect different parts of your body, from the head to the toe. So the effects vary, and they can appear anytime on your body. Yeah.
And let's talk about the data, statistics of how many lives are lost every year, whether globally or here in Kenya, through smoking. And are the numbers, the burden reducing or increasing, and why is the case?
I think the burden is increasing because globally we lose more than 8 million people on tobacco use. And in Kenya, we have annually we lose ranging between 25 and 30,000 Kenyans due to tobacco use. So this is a huge burden that we must all think together, implement the laws that are there so that we can reduce these numbers.
What is this that is smoked by people out here? What are some of these products?
Traditionally, we have cigarettes, and cigarettes are smoked, and I think each and every Kenyan knows about cigarettes. You just light it and you can smoke. But we have other products. Some of them we categorize them as emerging tobacco products. For example, shisha that was banned in 2017. It was coming out very strong, and you could see when you go to any restaurant here in Nairobi, there were each and every club and restaurant, there were places that were set aside for shisha consumption. And young men and women were actually getting into the habit. That's when the Cabinet Secretary for Health, by then, Cleopa Mailu, decided to ban the product because it was seen as a gateway to other tobacco products. Yeah. There is also the issue of lift, which are the oral nicotine pouches. And they are also gaining popularity in Kenya since introduction into the country by one of the tobacco manufacturers. Hopefully, we have tried our best to ensure that we control it or contain it, but the problem is still there.
Why do people smoke? Why I'm asking this, we always see health warnings you know, or during packaging of some of these products, but people will still go ahead and ignore them and smoke. Why is this so?
It's a saddening fact that people, even some of them who have gone to a level of being diagnosed with some of these diseases, for example, cancer, we have had people telling us that even though I'm this sick, I cannot stop smoking.
Is it as a result of addiction?
It's the addiction, and the most addictive substance that we know of, and it's in the cigarette and tobacco products, is nicotine, which actually, when ingested, plays around with the reward system in the body, whereby you need more of it to feel good or to feel relieved of the stress and such things.
Yeah.
And this is what we want to hit at, the nicotine in the product. Though there are different arguments which are actually advanced with people who are coming up with the modern tobacco products, for example, e-cigarettes and so forth. They say that the nicotine is not harmful. What is harmful is the burning of the cigarette. But we don't agree with that. Nicotine affects the brain of a developing child, and when introduced to teenagers who are less than 20 years, it will also affect with their brain development. So it's still a harmful product as it is. Yeah. Let's
talk about who is smoking in the country, the group of people. Is it the old? Who are smoking more, the young people, women or men?
The huge percentage of smokers in Kenya, I will say, is the young adults. Guys from the age of 25 upwards, up to maybe 40 years. And this is the huge percentage that is smoking. And we feel that a lot of our campaigns, government campaigns, and each and everyone who is a promoter of health should target this group, because this is the highest percentage of smokers. The old guys, some of them are dropping off, maybe due to health complications, but this is the most active group that the tobacco industry has tried, the young ones, that the tobacco industry has tried to maintain by bringing in, we have flavors in these tobacco products, so that they can disguise the real taste of the tobacco in itself.
And you mentioned that the burden is really high. So what needs to be done to minimize usage of tobacco products?
There is a document called the Framework Convention on Tobacco Control, FCTC. Kenya signed it in 2004. Okay? So by signing the document, we are obligated as a country, and different countries in the region have also signed, for example, Uganda, Tanzania, and so on and so forth. And we are obligated to ensure that there is reduction in consumption of tobacco products. Yeah. And what has been done, we have a law, Tobacco Control Act of 2007, which is just a domestication of the FCTC. And this law is very good, okay? Even though some will argue that it has some weaknesses here and there. But we believe that if this law is implemented, there'll be reduction in exposure to tobacco products. That is those who don't want to be exposed. And that's why we have the smoking zones, which are everywhere in the city here. And those who are running establishments like bars and restaurants should set a place whereby smokers can be able to seclude themselves.
You brought up the issue of second-hand smoking. Is the impact the same? Is the impact on the person who is directly smoking the same as someone who is secondly, or who is a second-hand smoker?
In fact, the impact is greater
for second-hand
second-hand smoker than the first-hand smoker. You see, the one who lights the cigarette and smokes, we have the filter that actually traps some of the particles, the chemicals that are coming from the smoke. And the scientists tell us that there are more than 70,000 chemicals in there. immediately you just take a puff, you are ingesting more than 7,000 chemicals, not 70,000. And 30, is it 65? I don't remember very well. Around 70 of them, between 60 and 70, cause cancer. So the impact is greater because for this person who is the first-hand smoker, there is that filter. But you, as a second-hand smoker, there is no filter. The smoke, with all its chemicals, is just getting into your lungs.
Thank you for that clarification. We can go ahead with the necessary interventions.
Yeah, the first one is that I've mentioned to you, and the other one is the issue with the advertisement of tobacco products. Since the law came into effect, we have seen a considerable reduction in advertising of the tobacco products. They are still advertising in different ways so that they can reach their consumers and even young men and women so that they can adopt the product. And the other area that we have seen considerable progress is the access and exposure to young men and women, sale of tobacco products to minors. Okay, that is prohibited in the law. You can't sell to an under 18 a tobacco product, and you can't allow an under 18 to sell a tobacco product. All this is in the law, plus demand reduction measures that I mentioned, whereby tobacco products should be taxed higher so that they are not affordable to young.
So right now they are affordable.
Yeah, they are still affordable. Yeah. For example, if you get a cigarette at 10 bob, 20 bob, it's still affordable. But when we increase the taxes, we'll find that the product will not be so affordable to young. And these are proven measures by the World Health Organization.
Yeah. And so what are some of these measures that Kenya is adopting right now, and where is the gap?
Yeah, we are trying to talk to our legislators so that the nicotine products are taxed higher, but there is opposition to that, obvious. The tobacco industry will not allow that. They want these things to be cheap so that young men and women can be able to afford them, okay? And the country is also moving steadily towards banning some of these upcoming products. Like, for example, we said shisha has been banned. We are also advocating that they can also ban the e-cigarettes and some of these products that are being smuggled inside the country so that we have a safe environment. And there is also the issue of accessibility, and we are asking the government to ensure that they are not easily accessible, especially to such groups that we want to protect from this product. So the government is moving steadily, but we think that we have slowed down because we are seeing illicit trade still going on in tobacco products within the country. We are still seeing single stick sales of tobacco products, which is not encouraged. We are still saying maybe young men and women can be able to purchase some of these products. And there is also the other part that I didn't mention is the issue of pictorial, okay? Cigarette packs should have clear pictures that actually show the harm that you are exposing yourself. For example, if you are buying a pack, that's the whole essence of selling the tobacco product in packs, not as a single stick, okay? Because when you buy in a pack, you will see the health warning, and you may be able to think twice, okay? But if you buy as a single stick, there is no, you won't see the pack. So all these are things that our government is doing, and we pray that we have better pictures on the tobacco products. We pray that enforcement agency can rein on those people who are trying to sell to young women and men, and even selling shisha, which is banned. Yeah. So these are all progress, and we think that with a little push, we can be able to move forward.
And where now would you place Kenya regionally as far as addressing this menace is concerned?
I would say Kenya is number one.
Okay. Is it in
Regionally,
Africa?
in the East
African region?
Yeah.
Okay.
Though there are those who that say that our law is weak compared to Uganda's law and so on and so forth, but in terms of implementation, we are moving steadily. We are trying to domesticate the law. Sooner or later, we'll be having the Tobacco Control Fund, which is also advocated for. And this fund, when it comes into place, it will help to mitigate the effects that the tobacco product has been causing us, okay? And some of these funds will be used in research and also in public campaigns so that we have people become more aware. As you know, there are no funds anywhere, and there have been a weakness with the issue of maybe public education, but when we have this fund in place, we believe that it will revive the public education that we all need, and so that people can be able to receive more and more messages about the dangers of tobacco use.
And how best should the country address the issue of addiction? Because you gave an example that someone is sickly, but they are not able to quit smoking. Yeah.
The issue of addiction is also something that we are trying to work on with the government. And luckily, NACADA came in this year during the World No Tobacco Day. And they were able to establish a quit line. And working together with the counselors and the non-professionals in this field, we have seen people getting help through the quit line, which is 1192, okay? When you just call that, it's a toll-free number, and people have been able to be helped. And we believe that with a little bit more public education and also access, ensuring that these services are available, people will be able to be helped so that they can quit. We advocate for professionals to help those people who are addicted, not each and everyone. And that's where we have the issue of the alternative tobacco products, whereby some people promote them as cessation aids, that if you use this, you can be able to stop this. Or if you use such a product, you'll be able to stop smoking.
That actually can best even address the issue of tobacco farming.
Yeah, but we believe that some of these products, they are just a ploy, but some by the tobacco industry, whereby they are trying to move people, because guys are getting knowledgeable. People know smoking is harmful. Now they are giving them something else which is equally harmful in the guise that they are helping them to stop smoking. But in actual fact, they are creating a new set of addiction for these people. So they are not helping anybody. We advocate that if you want help, go to seek the services of a professional who will be able to guide you through. It all starts with you yourself resolving that I want to stop smoking. There is no magic bullet. You must decide yourself. There is no pill that you will swallow and stop smoking. No. No. It's a procedure that will be helped through this process. And finally, we have seen people who have successfully stopped smoking. There is no replacement for use of tobacco products by either using e-cig or snooze or nicotine pouches. No, it won't work. It will only result in a dual usage, whereby you'll find yourself using this product, for example, Lift, at the same time smoking, which is even more dangerous.
Yeah. And for civil society organizations, what are some of the challenges that you're facing as you try to push for the implementation of these regulations? Is there political goodwill?
Yeah, there is political goodwill, but not to the extent that we ourselves want. because in itself, the government accepting and domesticating the law, that is goodwill enough. But there is a lot of challenges from the tobacco industry, which is resisting, and you know it's a multi-billion industry. They are trying to resist all this, first of all, by either weakening the laws that we have, derailing the laws, corrupting our leaders. All these are tactics that the tobacco industry is using. And you see, it's a formidable force, and we believe that whatever resources they use, by the end of the day, health must win. And the people's health must be protected from these harmful products. So that's a challenge. We have a serious challenge from the tobacco industry. We also have a serious challenge with enforcement of the laws that we have. And we are actually in discussion with enforcement agencies so that they can enforce what we have already. Help the young children not to access this product by ensuring that we sell the product in the pack. And if you have the product in the pack, you can be able to see the health warnings and all that, which can be a deterrent to you, so that you can be helped. You are knowledgeable of what you are doing.
Yeah, allow me now to welcome your advocacy message as we wind up.
Yeah, our advocacy message is targeted to our enforcers, law enforcers. And we believe that there is a lot that needs to be done in terms of enforcing existing law, in terms of having our police officers out there, our administrators out there, educating the public, and also having the issue of the government speaking with one voice. Because we have seen a lot of confusion here, whereby the Ministry of Health is saying one thing, and on the other hand, the Ministry of Trade is saying something else. We need all these government agencies to speak with one voice. If we say that tobacco is harmful, there is no need for the Ministry of Trade to encourage the sale of tobacco products in the country. No. As a government, they should actually come together and adopt the voice from the Ministry of Health, which is pro-health, so that we can be able to protect our people. When we look at the economics of tobacco, we find that for every shilling that the tobacco industry pays as tax to our government, the government in fact uses more than 3 shillings to mitigate the effect. The issue of cancers, the issue of trying to ensure that people have affordable health care and so on and so forth. You see, it's talking the same, different messages from the same mouth. So if we have the government speaking with one voice, we can be able to protect our people. We won't have to actually buy in the argument that the tobacco industry is paying taxes. The taxes, they are not helping us in any way. They are just increasing our disease burden. And you see there is also the increase of NCDs, whereby the tobacco use is a major risk factor for that.
Okay. Yeah. Thomas Lindi, thank you so much for being part of our conversation this evening. We appreciate your presence here.
Thank you.
Okay. And that is the end of our conversation this evening on your health show. Thank you so much for watching. I'm Purity Museo. I'll see you again next week, same place, same time. Do enjoy the rest of our programming, and God bless you.